Hey, hi, I'm Dr. Chasanal Rathod, pediatric ortho surgeon, and I will be talking about how and what to do for an effective social presence on the internet. So, if we see, we as doctors don't pay much attention to our web presence or social marketing, and so it does make a difference. So, let's see how and what has to be done. So we have this question many times, do we need to socially market ourselves? One. And if you meet one of these media companies or the marketing companies, you will just be surprised to see the kind of packages they offer to doctors. And that makes us think moreover that do we really need to market ourselves? So a couple of years back, there was this study done about the benefits of digital marketing. And we can see that certainly it has a lot of benefits in terms of patient engagement, which is increased to 81%, retention of patients, improving and creating a better brand for patients, and uh, conversion rates also. So it's quite common for patients to be sitting in the waiting area and just trying to Google the doctor they have come to visit or whom they have an appointment with. They want to know about their expertise, they want to know everything about them. So, a couple of years back, pre COVID, also, there was a survey done which said that most of the patients are online. And with the advent of more and more usage of phone and all the information, and not only information, I mean, the access to the services people have, right from buying groceries to ordering food to the extent of even investing in a gold. I mean, look at the amount of extreme use we make of the digital world. So 54% of customers, they always look around for a local doctor online on a weekly or monthly basis. So this number or the previous survey I showed kind of sounds little like a hyped up. Maybe some of you might think that it is just a media company gimmick to sell off this marketing, but I'll take you through a few of this just analytics of my own social media. So this I have picked up analytics from my YouTube channel only for the month of December. And if you see that 784 people have viewed my business profile, plus there have been 167 searches which have showed my profile in the results. So how does this happen? I'll take you through in the rest of the presentation. And if we look at Instagram again, so same has happened. I have managed to reach in a small span of less than 30 days. So I have managed to reach like around 3,500 people and accounts engaged again. So the thing is that how do we reach this amount of number or how to get into this marketing thing? So both of this analytics which I have shown, none of them are paid or none of them I run Google ads or promote or put any money for promotion. These are simple free, and nor I have like paid followers as well. So it's purely organic analytics of the web presence. So we see on televisions and at times in the newspapers that doctors are marketing. But if you see, these are not they never show doctors from India marketing. So usually they will try to show some doctor who is of an Indian origin or who looks Indian but practicing in UK, because originally it was not allowed for doctors to market themselves in media, television, or even on any other platforms. So that's how every time we have doctors, like they're trying to show outside India. So if you see a dentist practicing outside India or this one in UK, so that's quite common. So basically, our doctors allowed marketing, and So they are not. And with the recent NMC guidelines, which came up with the recent gadget in August 2023, so this is the recent one, and they compared to the previous guidelines. So I used to have this talk prior to the NMC guidelines also. And then they didn't have this specific guidelines for social media because when MCI rules were made, social media was not at this boom. And currently, with the NMC, yes, social media is like just booming. Everyone wants to be on the screen and scrolling. So they have come up with very intense rules of what not to do and what to do on social media and what has to be followed. So this I have picked up from the Gazette. And what kind of information can we share is like some information and announcements they can be shared, but they should not be misleading, deceptive, or exploiting the patient in terms of their knowledge level. Second, we are not allowed to discuss the treatment of patients on social media. It is not allowed. And we should also not post any photographs, scans, or images on any social media, because once the image is shared on that social media, it becomes a property of that particular social media. So we are not allowed to share that. And even our behavior towards our colleagues, they have just given about the professional behavior as well. And like I mentioned, that I don't have paid followers, or I don't promote my posts, or I don't pay for the posts. So even all this is not allowed. It is we are not allowed to pay anything so that we are part of the search algorithms. So we have to be very intelligently part of this algorithms, and I'll show you how. Neither are we allowed to share patient testimonials or recommendations or endorsements. So they can be done in a way. So let's see how it is. And we are not supposed to share videos or images of our impressive results and trying to solicit patients. So even that is not allowed. So what are we allowed is to share educative material. So we need to focus on that. So putting out educational purpose material is what we are allowed. And the same thing for the web page is allowed. So prior to the NMC rules, MCI did not allow a doctor to have their own website. It was not allowed. But now, luckily, they have come up with this that we can have a web page, but we need to follow the above guidelines again. And then okay, and we are not allowed to solicit patients directly, indirectly, in any form. So these came up with particular guidelines for social media. And the advertisement guidelines, so the same ones already existed when MCI had made rules as well. And so when and how can we use the advertisement purpose, particularly for formal announcement of a new clinic, change of practice, change of address, going on a long leave, going abroad or sabbatical for studies, or coming back. So all these things can be publicly declared or can be advertised. And so, yeah, and this one is again important, that even if we are working with a corporate hospital or a like whatever kind of setup, so announcements, there is a way which they should be done on social media, and it should not be containing the name of the institution or the type of patients being treated, or the staff, or anything which the fees or something. So they are not allowed currently. And also we can't market for the corporate hospitals to solicit patients. So we can make information stuff, but not this. Okay. So now that we've seen what are the do's and don'ts, and there are certain loopholes and there are certain ways which through we can market, and a lot of companies do help to do this. Now the question is how to do it and where to start. So there are endless platforms which people engage into and people are hooked onto. So a basic thing where you put up your genuine information is your website. Then you can have a lot of informational videos which are on YouTube. The same videos can be shared on our WhatsApp stories, Instagram, Facebook. And then there could be certain posts which again can be shared on YouTube and all of this channel. So now with the Meta, with all this social media is coming under one platform, it has become easier. The interface is easy, and the material can be shared across all the platforms very easily. If you post on Instagram, there is an option to share it on Facebook. And similarly, it has an option vice versa to share on WhatsApp. So Facebook makes it easy to share on WhatsApp also. And of course, the web page is always there. So now the question is that we do have, so some people do have certain social media accounts or platforms, but they don't have subscribers. So yes, the subscribers are different for each platform. So like for me as a pediatric ortho, the younger generation parents, they are more onto Instagram. So I have seen this change over the past decade where parents earlier used to be more on Facebook, but now they have shifted towards Instagram, the young generation. And of course, Facebook still remains there. And with the Facebook, we have an advantage of picking up our where to promote our posts. So there are in the options, there are settings like how many kilometers do we want to, what kind of number do we want our post to be visible in, the demographics, and what age groups. So we can do the target oriented subscribers or audience selection on Facebook. And WhatsApp can be used very easily on our clinic mobile. So the clinic mobile should always have some information, stories, and status every day so that our patients who call upon that number for appointment always have some information on the WhatsApp stories. So the subscribers will get different on different platform, and we don't need to run behind it. It just builds gradually. So what happens? So coming to the first platform, that is Google. So of course, everyone wants to Google everything. When they start looking out, if they have some symptoms also, they would want to make their own diagnosis on Google. And if they've got a diagnosis and if they've been asked to meet someone, that's where they search. So if I look out for my search on Google, so I'll find one of the main hospitals I'm attached to, then the practice software which I use, it's on the second is that, followed by my own website, and then a social media. So you see how interestingly Google also uses all the different social media platforms. It has just not used all one type, but all different kinds. And they try to provide a wide information in different ways. So coming to the first thing, that is the website. So the website should identify us either by our name or our specialty. So I picked up my name since it's quite easy to get a website by this name, since it's a very rare thing. So either, or you can pick up a specialty, like I could have picked pediatricortho.com or pediatric ortho in Mumbai, something, the domain which is available. Second, we need to see that our website gets the maximum searches by doing a search engine optimization. So the marketing guys know to do how to boost the SEOs. And second, our website should have an appointment integration. So anyone who visits the website should have in the link to book an appointment or seek an appointment. And it should have a small comprehensive information about the doctors, the various other activities we perform. And since the feedbacks are not allowed, they should be usually avoided. But I would suggest we put up some blogs, some information videos, and connect it with YouTube and other social medias itself. Now, the main thing in this, that's why I put it up in caps lock, is the disclaimer. So every website should have this at the end. So before NMC, when the website was not allowed, I had specifically put up this thing that this is only for information purpose and not for soliciting patients, because it is what it is supposed to be. Otherwise, somebody can take an action one of the days when some rules set in. Maybe we have to shut down the websites as well. We don't know what happens. So some certain disclaimers should be always there, and these two are very important when we put up a website. Then coming to other social medias like maybe Facebook, Instagram, LinkedIn. So there should be always, if you are very fond of sharing the personal pictures or have a bunch of friends, then it's always good to have a separate personal profile and a separate professional profile, because you don't want your patients to know more about your personal life, your family, where you eat, where you go on vacations, what you wear, how you spend. That is none of that information they need. What they have to know is more about our services, what kind of patients we treat, or what do we do. So that all can come in the professional account. The professional account needs to be an open account, while the personal account can be a closed account where you approve the request based on whoever wants to follow you. And the professional can be an open account. So if we put up a right information, the account builds up very well. So here is a very fun example of how we put out the right keywords when making a profile. So if Gabbar Singh had such keywords in his bio, it would have not that been great. So picking up the right picture, the name, and the key specialities and what are our strong points is important. So if you just, I'll take you back. So like I have put my specialty followed by certain important things, and the Linktree has Linktree is a different app which holds multiple web links on one particular platform. So when if you click the Linktree on my Instagram, you'll see it goes to my website, it goes to my YouTube channel, it goes to some important videos which I want to showcase. So it becomes easier because Instagram allows to just share one or two web links, but Linktree can help us save n number, whatever we want. It can be saved through LinkedIn. Linktree. So after creating an account and after putting up a good bio, now the next thing is what content to make, what kind of post to make, or what should we post day to day. So following these rules, we just again take into consideration this and accordingly make simple information videos. So like I have this video or basic information on what a clubfoot means. And suppose if there is a woman who's antenatally diagnosed with clubfoot, usually they consult me and I send them across this video. They have a look and it provides complete information. Also, certain exercises or which need to be done, like this year, the clubfoot maternal manipulation, or at times post-op exercises, or how to take care of plaster is one of the videos I usually share. So all of these information videos have to be shared without asking for patient, without giving out any information of the hospital, where to reach you out, without putting out the fees or our contact details as well. So we have to be very careful how we make this video. So now you have put up a video also, and you made a video or you made a post, but still you feel that somebody gets thousands of likes and somebody just gets one or two likes. So how to get a good social engagement on social media? So first thing is we need to connect. So connect with our own colleagues. So if you go to certain meetings or place, get connected with them, post a picture and tag everyone. So that's how you connect. And that algorithm captures and it connects you to more people you know. Second, you can also connect with colleagues on LinkedIn. But yeah, social media has a different little way of connecting. But yeah, this is a much more better way for connecting with like-minded colleagues. Then connect with patients. So usually most of my patients, they like to connect with me when they come to the hospitals. They like to take pictures with me. They bring a card or some gift for me. So I always like to post this and tag them, or they post it and they want me to tag them. And so that's how it works. So connect with the patient. It takes a little time, but then you kind of reach out their network. So then the people who are following them come to know that they have a doctor who's so and so, and it adds up to your marketing in some way or the other. So many of my patients, they take pictures and post with me, and I repost their posts, like I said, and it does make a lot of difference. So you must have seen in the previous post, I had like these hashtags. So each of the posts, they have a particular hashtag here. So why this hashtag is important and what does it say? So if most of you remember the last to last YROC, which we had at Geo, they had this hashtag YROC Max 2022 displayed outside. So let's see what the hashtag means. So basically, hashtag is kind of a keyword or the search engine word. So whenever we put something with a hashtag without a space, so all words have to go without space, and there need not be any punctuation marks or something. So if suppose somebody searches on Google a birth brachial plexus palsy, or somebody searches this surgery, or suppose a spica, so they automatically are directed to this Instagram post of mine, which has all of these hashtags. So that's how hashtag helps for Instagram. On the YouTube, there is a thing called tag where you can put certain number of words. So similarly, if somebody wants to search a genuarum, a valgum, or why rickets happened, or what surgery, so the moment they place this out on the search engine, it gets identified by the algorithm, and the video which I have posted gets picked up. So like I have posted this certain videos of varam and valgam, and they will have those tag words there. So apart from the putting tag words, you can make the same videos in two different languages. So I have this same video which is in English, and the same video which I have made in Hindi subsequently. So this had very good viewership, around 6,000 and more. And many of my patients, they put up in comments that please make the same video in Hindi so that we understand it well. And accordingly, I did that for them. So don'ts are very common, and we are all aware of these don'ts. So first is we don't need to buy any paid followers. We will, if you post the right content, you will get the right following. We should not promote our post. It is not allowed as per the NMC. And of course, hiding the patient identity or taking their consent before posting. So some patients are okay. I mean, they don't mind their face visible, or they don't mind talking. So that is allowed. And second, we should not post their personal pictures as well. All this can be overwhelming. See, making a video, doing this, doing that. So at times you might need to take help of certain professional agencies. And so I have been using Mavera solutions for past maybe like 6 or 7 years or so now. And recently I made some videos with the ad doctor. And they have a tagline called Marketing Meets Medicine. And the owner of the company is a doctor. So they very well know how to make videos for certain YouTube channels, and very nice animation. So one of my videos on YouTube, that is Fractures in Children, has been done by them, and you can maybe visit the YouTube, just search it and you'll find it. It's not on my channel, but it's open and you can just find it and search it. So coming to some of the part which we focus a lot on, that is the Google reviews, the feedbacks, and how to get the pre and post recommendation video from patient. So first thing is NMC does not allow this. So don't put a lot of time on this. And now I don't know if everyone is aware. So recently Google has just come up that whoever has made a website through their Google web page, they will be closing those websites. So there have been certain changes, and soon these Google reviews also may not stand valid for us here. So what do we need to do for feedback? So they shouldn't be glorifying us. One, it has to be done in a very subtle way. So I'll show you. So I don't personally use Google reviews, not at all. So all these years with even a marketing company, they also told me that I shouldn't be using it because it can be misused against us, one. And most of the time they're not genuine, they are not verified. So I have my own links for taking a patient review. And through this app, the patient verification is done. They are supposed to upload the paper or my clinic paper where they visited me, and then only it gets published on the website there. Okay. So coming to the end of it, that do we really need marketing? So let's look at it. So most of the users are online with our very app-based busy lives. Marketing does help us to target the right audience. And digital marketing is quite cost effective rather than the hard paper marketing. So making a book or putting out flyers, unlike traditionally it was done, this is cost effective, it's manageable, it's easy to handle, it's easy to engage and interact with patients and people again. And it also helps us to develop, improve, and grow our online reputation. And of course, the FOMO, the fear of missing out. So, some point of life in our career, we feel that we are doing great and we don't need to do this. But there'll always be a FOMO that some of your competitor or the younger generation is doing it, and you need to catch up on the trend. So that's why you need to do it. And I take it as a onus on us as a responsible doctor, rather than blaming WhatsApp institution that they are spreading wrong information and fake information. Why not we as doctors spread out the right information? Because then it takes away all the wrong things floating on the WhatsApp institution, and at the same time it helps us to market ourselves also in a better way. So what needs to be done? So first and most important thing is to get a website, get a very good web presence in terms of various sites. So once you post anything on website, many of the other web pages, they copy your information and they just use it. So it can be allowed. They usually don't take up permissions and it's not paid either. So they just use it for their own clicks on the web page. And there is a lot of social media which can be used. Information content can go in the form of posts, videos, reels, or shorts. And the same thing. So a simple post can be used as a on the Instagram, on YouTube, on the WhatsApp story. And similar small videos can be used as reels on Instagram and shorts on YouTube. And one particular, whatever content is being made, it should be shared across all platforms. So like WhatsApp stories, status, on channels, on different media channels. So maybe you could use the same video and give it to different hospitals and they can put it on their channels and share it as well. So that adds to your credentiality more and more. And we could leverage the reviews and feedbacks in a right way. And to get more better patient engagement and retention, good WhatsApp communications and reminders is what is needed. So there is a lot to do, but let's not forget that nearly 41% of the people who visit their hospital are always influenced by the social media, and we need to work on it. So apart from this, if anyone feels that they need to have more information, need some help from my side, I am okay to be reached out on WhatsApp or on the Instagram. If you want to go and have a look at my website, it's this. And on the YouTube channel, you can search me as this or as Chasanal. There's a A missing. There's been a small spelling mistakes in certain videos, so it's there. So, but do connect if there's anything I can help you through. And be trendy, catch up with the trend. And don't forget that the younger generation is much more faster in terms of finding information, analyzing and judging and picking and making their own decision. So it's important to remain at par with them too. So thank you.